Welcome, everybody. I see that people are joining us. We're going to start in a minute. This is the Child Welfare and Early Childhood webinar on CrossSystems Collaboration to improve outcomes for young children and their families. This is the second webinar in our series, and this topic today is on cross-systems engagement. I am your moderator, Cynthia Tate. I am with the Build Initiative, and we are the sponsors along with the National Collaboration on Infants and Toddlers Capacity Building Hub. So we welcome all of you. Our folks are signing on in, so we want to give another minute or so for folks to get here. We're going to ask everyone if you would put your questions in the chat for your so that we can ask those questions during the Q&A session. That will be the last 30 minutes of the webinar. And the first hour of the webinar will be presentations by some very, very fascinating and knowledgeable people who are coming to talk to us today. I'll just let you know also that we're going to have slides and resources available to you after this, and the webinar is also being recorded. In a minute, we're going to have a poll. We're going to wait for just a couple more people to come on. I'm watching the numbers, and as they slow down, we'll launch into the session. So welcome everybody that's here. Please feel free to introduce yourself also in the chat. It's always great to see where people are coming from. During our first webinar, we had upwards of 400 people from all across the country. So it's good to be able to see that we're having really a national conversation here on this topic. Right, here we go. You're seeing those names and those states coming in. Hello, everybody. All right. At this point, we're going to have a little poll. Thank you, Jonathan. These are just really a very few questions in order for us to be able to have a better idea of our audience and where you're from, not just geographically, but what fields you work in and what knowledge of child welfare and early childhood you feel that you're bringing as you listen to our webinar today. So you can see the poll in front of you. Just click on the answers, and shortly we will have the results, which we'll share with you. Welcome, everybody. We're watching all these folks come in here through the chat, introducing yourselves. We're so happy that you're here. Thank you for joining us. Everybody take a minute to just fill out. There's only 4 questions on this poll. It's pretty short. All right, everybody, we're going to end the poll and let's see what we have so far. It looks like, of course, our early care and education folks are at about 50% of our audience right now, but we also have about 26% of our audience coming from other early childhood programs. We have about 13% of our audience in a field that's adjacent to child welfare, where child welfare is a priority. And we have about 11% of our audience from child welfare. So welcome, everybody. Thank you so much. As far as how well people feel like they understand the early child welfare system in their state, 49% understand some, so that's great. 26% understand a lot, and we have 6% that are experts, so awesome. We just have 1% that said not at all, so pretty much everybody has some level of understanding of child welfare in their state, so that's great. We have almost a 50-50 split here of the folks who actually know something about change efforts that are currently underway in your state. 55% said yes, 45% no. And then we asked the question specifically about the infant-toddler court teams because we will have two presentations today that will talk about the infant-toddler court teams. And so 55% of our audience here today is not familiar with the infant-toddler court teams. So we're really happy that you're here, and you're going to hear about something that's really a phenomenal thing that's going on that shows that these collaborations do work. We have 22% that know a little. We have 13% that understand some of it, and 10% that understand a lot. So wonderful. This is good to know. Thank you so much for filling out the poll. And again, I just want to ask everybody to please put your questions in the chat. You can put your questions in the chat at any point during the presentations. We will hold them, and they will be collected and given to us at the end of the presentations to so that I can ask those of the presenters on your behalf. Okay, let's move to our next slide. All right, so for those of you who were with us the last time, this will all look very familiar. We have the same objectives this time, and we will for each of our sessions. Our first objective, of course, is to raise awareness about young children and their families encountering or involved with the child welfare system. We want to educate participants about the racial disparities that are in family separation from child welfare involvement. And what we mean by family separation from child welfare involvement is children who have been removed from their homes and placed into foster care or other out-of-home settings. We want to promote opportunities and strategies for prevention for families and communities. And we want to provide examples of cross-systems collaboration on behalf of our youngest children. Next slide. So for today, specifically, what we're going to do is that first, we're going to start off with a review of some research on policies and practices to support maltreated infants and toddlers and their families. And then we're going to move on to learn the framework and strategies for cross-systems engagement in infant-toddler court programs. And then we're going to learn about a navigator program in Washington State at their Department of Children, Youth, and Families, the Child Welfare Early Learning Navigator Program. And then we'll have a discussion of the challenges and successes of collaboration between early childhood and child welfare systems. Next slide. Our presenters today I'm going to just call each one's name, and then if you want to come off your mute and also show your picture, great. You can go ahead and introduce yourself. So our first presenter is Tori Silloway.
Hi, everyone. Thanks for having me today. I'm Tori Silloway. I'm the Director of Policy and Financing with the National Infant-Toddler Court Program, which is part of 0 to 3.
Thank you, Tori. And we have Darneshia Allen.
Hello, everyone. It's a pleasure to be here today. My name is Darneshia Allen, and I am the Director of Practice and Field Operations with the Infant-Toddler Court Program under 0 to 3.
Thank you, Darneshia. And we have Erin Havik.
Hey everyone, we are honored to be here today. My name is Erin Havik. I'm the Primary and Community Prevention Lead at DCYF, which is part of our Strengthening Families team.
Thank you, Erin. And lastly, we have Minette Mason.
Hi everyone, it's so good to be here with you all today. I am the Child Welfare Early Learning Project Facilitator, also with the Strengthening Families Washington team at the Washington State Department of Children, Youth, and Families.
Welcome, Minette. So thanks to all of our presenters. Let's move on to the next slide. So I just want to revisit a little bit of this data. Folks who were here last time have seen this, but folks who may not have been here last time or may be interested in a recap, this is the question of what does the data tell us about young children in child welfare? About 40% of children who are confirmed by Child Protective Services as victims of child maltreatment are ages 0 to 4. That's 40% of the children in child welfare. Infants and toddlers are removed from their homes at a rate more than double that of children aged 4 to 17. And there were 30,687 infants under the age of 1 in foster care. And that data was from 2019, and 145,000 children between 1 and 5. So we say these numbers so that people understand that we're not talking about some small number of children who happen to be a small subpopulation. We're talking about a lot of children and a lot of very young children. And we also are talking about the fact that children of color are disproportionately represented in foster care. So with that, we will move on and welcome our first presenter, Tori. Tori Silloway, your turn.
Great. Hi everyone. Thanks again to the Build Initiative for having us on today. Let me know if my voice ever drops and people can't hear me. Maybe give me a thumbs up, Cynthia, and I'll speak louder. But hi everyone, I'm Tori Silloway. So I work at 0 to 3. I'm part of the National Infant-Toddler Court Program, as I mentioned, and I lead our policy and sustainability work. You can go ahead and go to the next slide. Next slide, please. Great. So you'll hear more from my colleague, Darneshia, is also on with me today, about the work of the Infant-Toddler Court team and really our work on the ground, working with families and communities and states across the country. But I'll just sort of briefly introduce the program a little bit here so that you're grounded. The Infant-Toddler Court program works with families of infants and toddlers who are under the court's jurisdiction and either in or at risk of entering the child welfare system. The aim of our program, we work to apply the science of early childhood development to meet the needs of young children and their families so they thrive. Our program is supported by HRSA, the Health Resources and Services Administration, which allows us to bring a unique public health perspective to child welfare. Next slide, please. Oops, I think we might have skipped one slide. Oh. Well, that's okay. Can you go 2 more slides? I think we may have been missing one. There we go. Then we'll go backwards. So I apologize for my slides are out of order. So I wanted to start today by talking about how state child welfare policy addresses the needs of infants and toddlers and families. It's important to note, particularly folks not that familiar with child welfare, that while the federal government provides overall guidance and certain requirements for state child welfare systems to comply with, states and in some cases counties also play an important role in determining both policy and practice in child welfare. So what do we know about state child welfare policy, and particularly how it addresses the needs of infants and toddlers? Much of what we know comes from 2 surveys conducted by Child Trends with support from 0 to 3. The first was done back in 2013. And then most recently, we did another survey in 2019, also conducted by Child Trends with support from 0 to 3 and HRSA, that looked at state child welfare policies and practices specifically around infants and toddlers who are either in or candidates for foster care. And I'll just so folks know, that term candidates for foster care is a child who is identified as being at imminent risk of entering the foster care system, but can otherwise remain safely in their home as long as services are provided necessary to keep them safely in their home. So I believe you have a link to this report, and if not, I can put it in the chat at the end. The survey has a lot of great information, and I just wanted to share 3 high-level findings from that report to kick us off, and then I'll go a little bit deeper. So the first finding is that state policies and practices for infants and toddlers who have experienced maltreatment and their families have not significantly changed since that 2013 survey was administered. And many of the areas that we identified for improvement back in that survey remain today. So for example, no states have policies that require more frequent caseworker visits for infants and toddlers in foster care relative to children in other age groups. And few states have more frequent court hearings for infants and toddlers in foster care. The second finding is that states overwhelmingly do not differentiate their policies and practices by age. And so certainly while all children in foster care can benefit from expedited or more intensive services and supports to promote healthy development, research shows that infants and toddlers are really in that unique developmental period and especially benefit from these additional supports. And the third finding is that supports are more often required for parents of children who are in the foster care system already, and so their child has already been removed. So those then, rather than for parents of candidates. So in nearly all cases, more states require services to be offered to parents of children once those child have been removed, rather than before they're removed from care. And so while this highlights an opportunity really for expanding services to parents that could prevent them from entering the foster care system in the first place. Next slide, please, and then I'll go a little deeper in some of these findings. I'm sorry, could you go back one slide? I apologize, to the first one. Yes, and then we'll skip ahead. So we asked states what supportive practices or services as part of the survey were routinely provided to meet the social and emotional well-being of infants and toddlers who are in foster care or candidates for care. And you can see here the most frequently reported support was supervised visitation, although the survey didn't ask about the quality of the visitation or how much mentoring or intervention support is provided during that visit to strengthen the parent-child relationship. And this is important because research shows that appropriate quality and timeliness of visitation, or what we call family time, can help facilitate that strong, secure relationship between the child and their caregiver. Among the least frequently reported supports provided were assessments of the parent-child relationship and the child's social emotional well-being. So again, these supports are important because secure attachment with that primary caregiver is really essential for that healthy infant-toddler development and acts as a buffer to stress. And I'll just point out that just over half of states responded that they require developmental or behavioral health screenings for this population. And so that means obviously the other half do not. Next slide, please. Well, one more. Thank you for doing that. So the survey also looked at the extent to which states require or routinely offer screening and referral for parents to substance use and mental health services. So hopefully this isn't too hard to see. The blue bar is for candidates and the orange bar there is for those who are in foster care. While not all states require screening for substance use and mental health needs for parents, you can see here that the screenings are routinely offered. So that is the gray, the green and the gray bar there. So you can see how it goes up. And also when assessments are offered, nearly all states reported that parents routinely participate in them. So that's those last two bars. So this is a critical issue because most children in child welfare have a parent with an alcohol or other substance use disorder. And the percentage of children entering foster care because of parental substance use has increased significantly in recent years. The survey also looked at whether states offer other types of supports for parents of infants and toddlers who have experienced abuse and neglect. We don't have a slide on this, but I'll just sort of let you know what they are. The most frequently required supports by states were, again, screening for referrals for substance abuse and mental health, as I just mentioned, legal supports, housing and food supports, and parent skills programs. The least frequently reported supports for parents were mentoring or peer support, information about coping strategies for managing stress, and parent-child relationship interventions. And also, in all categories, supports were more often required for parents of children in care than for parents of candidates or those at risk of coming into care. Next slide, please. As I just mentioned, interventions that address the parent-child relationship, including home visiting programs, were one of the least likely services to be offered by states. We asked states which child-parent relationship interventions are routinely offered or required, and states also reported which services parents participate in routinely. And you can see from the chart, very few states require any of these parent-child relationship interventions, and just over half said the interventions are routinely offered. Again, this is important because access to these interventions, such as dyadic therapy, like child-parent psychotherapy, can help detect early infant mental health problems and/or prevent them from taking root. Next slide, please. The survey also asked states about their policies related to providing training on developmentally appropriate practices for those groups that whose work regularly involves contact with infants and toddlers who are in foster care or at risk of coming into care. Not surprisingly, frontline child welfare workers, their supervisors, and other child welfare staff were most likely to receive this training. On the other end of the spectrum, training in developmentally appropriate practices was not frequently required nor offered to mental health and substance use disorder professionals, attorneys, judges, and other court staff. The part there in the middle that we circled are home visiting providers, early learning providers, and Part C, early intervention providers. Next slide, please. So this chart shows whether states have report having formal or informal linkages at the state or local level with other entities that work to support infants and toddlers or their families who are in foster care or at risk of coming into care. So you can see states universally reported many connections between child welfare agencies and other entities. So that's you can see that as a plus. The most frequently reported linkages were with law enforcement agencies, Medicaid or CHIP programs, public assistance programs such as SNAP, substance use disorder treatment programs, and family court. Next slide, please. So I'm just going to shift gears a little bit. So that's the survey. I just wanted to put that as a backdrop. That's sort of what we know about the state policy and child welfare and some of these issues that I thought would be most relevant for this conversation today. And I also wanted to talk about now some of the work that we've done since that survey was launched in 2019. Over the past 2 years, we at 0 to 3 have been looking at what policies and practices states can implement to transform their child welfare systems to be more responsive to the needs of infants and toddlers and their parents. And in doing so, we looked first at how states can support families so they never need to touch the child welfare system in the first place, which you may think of as the prevention system. And second, for families that do come into contact with the child welfare system, how can we create a system that, again, is more responsive to the needs of parents and caregivers and the developmental needs of children. So this is part of a new policy framework that we've developed. It'll be released in April of this year. It's not quite finished yet, but I'm just going to highlight and sort of preview some of the work from that study, from that report that's coming up. Next slide, please. So first, on the prevention side, how do we create a continuum of services and supports for families that need assistance? So this includes the primary and secondary prevention services that can support families. And how can systems identify those families that need additional services and then enable families to be able to access those services without having to fear coming into contact with the child welfare system or being investigated? We know from research that poverty is often mistaken mistaken for neglect, resulting in increased reports of child maltreatment and out-of-home placements. And this is particularly true for families of color. We also know that families don't get linked always to the support they need until a crisis occurs. And often those services they do get don't necessarily address those underlying issues. So the opportunity here is to ensure that families have access to the supports and services they need really when they need it. And so I'm just going to mention the sort of 4 bullets on the right-hand side there in the opportunity. These are sort of 4 buckets of policies that we are looking at in our policy framework. The first is really around good health. So we know that infants and toddlers with access to health coverage are more likely than their uninsured peers to see a doctor regularly and receive preventive health care and treatments, also getting routine checkups and other preventative care. Effective policies that we're looking at here and that we're looking at in our policy framework include things like providing health insurance for all families by adopting Medicaid expansion under the Affordable Care Act, providing a central medical home for all infants and toddlers, following the American Academy of Pediatrics Bright Futures guidelines for universal screening of infants and toddlers, and increasing access to infant and early childhood mental health services. The second area here are policies that ensure families have access to supports that meet their basic needs. So states play a key role in determining the extent to which supports for basic needs are available and accessible, and states can implement strategies to make it easier for families to access these benefits or services, such as through coordinated enrollment across public programs, expanding eligibility, and co-locating services. So some of the policies that we're, again, recommending in our report look at things like enacting family-oriented workplace policies, such as paid leave and medical leave, paid sick days, and fair work schedules. Also creating a continuum of parent support services and resources. So things like including child developmental specialists in pediatric settings, home visiting programs, and family resource centers. Also expanding economic security policies. So things like the EITC or Earned Income Tax Credit and Child Tax Credit, both of which help low-income families provide a strong foundation for children starting at birth. Third area here is early care and education and strengthening those services. So states obviously have a significant role in determining the quality of early care learning experiences and determining the extent to which families have the supports and can receive them. So here, effective policies we're looking at ensuring that low-income families with infants and toddlers can afford safe, stable, and high-quality childcare. Increasing state investment in infant-toddler childcare to reach more families while also improving the quality, and expanding early detection and early intervention services to fully meet the developmental needs of infants and toddlers. And finally, looking at ways to support building that community level system, including providing navigation services and/or case management, really to help connect families to the services and supports they need and increase their engagement in those services. So here we're looking at things like meaningfully partnering with parents, including fathers and caregivers, when designing and implementing those prevention systems to make sure they're accessible, inclusive, and relevant to the community needs. Creating central access points for families that are community-based and that can provide a range of services and supports to help strengthen families. Also implementing targeted outreach efforts, including providing funding to support those enabling services that help increase access to and participation in services. So things like transportation services, childcare services, and health education. Next slide. And just with my, I know I'm probably up about against time, last slide here. The second part of this is really that states have an opportunity to transform their child welfare systems to be more responsive, again, to the developmental needs of infants and toddlers and their families. Research shows that early identification of needs and services for young children and parents can help improve child safety, increase well-being, and facilitate permanent child placements and strengthen families. Research also demonstrates the importance of actively engaging parents in decision-making and in creating those judicial policies and practices that can empower parents and reinforce the importance of maintaining child-parent relationships. So some of the policies in this area, sort of more on the child welfare side, once you've entered the system, what we're looking at are things like adopting early childhood development principles into the Child Welfare and Dependency Court and family court practices. This is something that our program, the Infant-Toddler Court program, does a lot, and Darneshia will speak to this. Providing infants and toddlers with regular screenings, comprehensive assessment of needs, and timely referral to those appropriate services. So we know there's often a disconnect between the screening and assessment of parents and the services they get. And also a significant percentage of children in foster care do not receive even basic health care, such as immunization, dental services, hearing and vision screening. Requiring frequent high quality family time, what I mentioned in the survey we call visitation, and what we call family time for infants and toddlers in out-of-home care with their parents and siblings. So state child welfare systems often require these visitation plans between parents and children. However, these plans often sort of can often reinforce minimum standards rather than really promoting best practices. So there's an opportunity here for states to create policies that ensure that children and their families have frequent opportunities to spend quality time together. And these policies can specify sort of the importance of that ongoing frequent interaction. And finally, creating a network of family support partners or mentors to help families navigate the child welfare and system and court processes. Parents that are investigated by the child welfare system often feel isolated and confused by what can be a really bureaucratic process. Parent mentors, in some cases also called parent support partners or family allies, are one approach that can help address these challenges and really work with parents. These are often families with lived experience that have already sort of gone through the system and can help parents that are just encountering it for the first time. So that's a little flavor of our policy framework, and I hope I didn't sort of overwhelm people with so much detail, but I'm happy to answer questions sort of going forward. Pass it back to you now, Cynthia.
Thank you, Tori, very much. You got a lot of questions that came up while you were speaking, and we are certainly going to relay some of those questions to you later during the Q&A, and we appreciate everyone who is making your entries with their questions or comments into our chat and into the Q&A. And so we're going to just go on now. That was a great lead in right into our presentation by Darneshia Allen about the infant-toddler court teams. Darneshia?
Thank you, Dr. Tate. Again, it is a pleasure to be here with you all today and kind of dig in just a little bit deeper into what really was laid by the foundation and information that Tori just shared with you. We actually launched our work in Illinois roughly in about 2015, 2016 in the journey in creating the early childhood court team under the direction of Dr. Kimberly Mann, who is the deputy director under the Office of Child Wellbeing. And in that work and the focus with Cook County and the early childhood court team, we were really aiming at creating a system that was family-led and family-empowered. Also hoping to bring an understanding around trauma and the effects of very young children, the effects of that on very young children and their parents, and looking at developmentally informed practices, focusing on the child's sense of time, being involved in child welfare and their well-being while they try to reach timely permanency. We were also aiming at wrapping all necessarily and culturally informed services around the families in a coordinated system of care, engaging stakeholders in this process so that we address the array of needs that are encountered by families while they're involved with child welfare, but doing it in a comprehensive manner. Using this in a base of a court that is informed and supportive and non-adversarial in the work that's being done by judges and attorneys. Also hoping to build this reflective culture, if you will, among all parties, adopting this posture of learning and communication and self-understanding for families. And lastly, really hoping to create this environment where all parties feel included, most especially families, so that they feel safe and respected in this journey. So next slide, I'm going to dive in deep into how we do this on the national level. So our work is actually, as Tori shared with you just a moment ago, funded by HRSA, the Health Resource Service Administration, and Maternal and Child Health Bureau in the Division of Home Visiting and Early Childhood Services. But we have a partnership in this work that is combined with the American Bar Association, on the Center of Children in the Law, a partnership with the Center for the Study of Social Policy, with the National Council of Juvenile and Family Court Judges, and then we have independent evaluations that are led by RCI International. And that work combined allows us to touch very intimately unique audiences who are living and thriving in this work. That has since been elevated by our National Advisory Group for Parent Voices that Tori spoke to earlier, which really helped us bring in the story through the lens of the parents, because we think we know what they need, but it's so different when they tell us directly how we can support and engage them. And we use this multidisciplinary approach on the national level the same way we hope sites emulate that at the state and site level. So next slide, please. What we know, and what I'm sure you know, is that the first 3 years of life encompass the most critical phase in brain development. It is during that first 36 months, what we preach all the time, that first 1,000 days, that the foundation is actually being laid for how a child perceives the world around him or her. It's this safe and encouraging environment where the child is surrounded by loving adults. They have every opportunity to grow and thrive and be this happy child and a curious learner. Or is it a dangerous and sometimes hostile territory where adults can't be relied on to respond appropriately to the child's needs, either because they don't have the capacity or they lack the resources to do that? And we know that the stakes are high, no matter what the underlying causes of that. But what we know is that the developmental neuroscience demonstrates that this is the time when that foundational level of the brain's architecture is being laid. This is that moment where we have to intervene on behalf of very young children and their families. So how do we do it? Here's where you come in. There's a highlighted focus on infant and early childhood mental health, looking at the necessity of strong attachments in the way we drive decision-making by meeting families where they are and supporting them in their social determinants of health, treating this relationship in the context of a public health crisis, which we know is an inherent part of the structural makeup of families who are at risk, and also by taking a strength-based approach to a multi-generational experience for healing across the divide for families. At 0 to 3, our mission is to ensure that every infant and toddler has a strong start in life. And so our goal in the Infant-Toddler Court Program is to advance the health and well-being for very young children and their families. We do this so that they have the opportunity to flourish. We do this by applying the science of early childhood brain development into the work of child welfare. As Tori shared with you before, our target population is children under 3 years of age who are under court's jurisdiction or who are in foster care or even at risk of being removed. Our first Safe Babies Court team actually started in 2005, and it's a little bit of a fight on who started it, either Miami-Dade, Florida, or Fort Bend County in Houston. But ultimately, we launched 5 sites when we started this work, and we've grown to serving over 106 sites across the country. Next slide, please. So here's what we realized. This is recent data that was recently, this is new data that was recently released in FY20. Every 7 minutes, if you weren't aware, there is a baby or a toddler in the United States that is removed from their parents due to abuse or neglect and sent to live in a foster home. Every 7 minutes. So think about how often that happens while we're on this call alone today. We know that babies and toddlers, as was shared at the beginning of the call, are the largest group of children who enter into the experience of maltreatment in the United States. Recognizing that we're sitting in an umbrella where 33% of children are under 3 years of age, and that children under 1 make up 15% of that total population of children in care. And when I first saw this information, it just kind of freaked me out just a little bit. And I thought, oh my gosh, This is insane. And how do we get in front of this? And then it gave me hope to think, wow, what if we got in front of this? What if we actually prevented them from coming into care and caught this at smoke instead of when it was on fire? And even when we reached that place where it was a point of no turn and we had to deeply intervene, what if we prevented them from re-entering the system? By touching this population of 33%, we would ultimately drive down the number of children who are in care in this country completely, just by focusing on that population. Not to say that older children don't need that additional support and care, but if we target in a completely different way, rewire how we're working collectively to do this, we could shift the trajectory for children in care in this country. Next slide, please. So how do we do this? This is the core components of the Safe Babies Court Team approach. What you see here is a very intentional structural framework that guides our approach and the way we're working to move the needle around systems change and shifting that trajectory for young children and their families. So our work falls into 5 primary strategic areas. The first is all about who those key people are who are around the table, having that interdisciplinary, collaborative, and proactive group of folks who are working to drive change. It starts with having a committed judge and committed child welfare on board to do this work, and having an awesome and amazing community coordinator, which in Cook County, they're lucky enough to have 3. And then having all those folks around the table who we call the active community team, which I'll share a bit more with you about that in a minute. And those folks are on the ground and mobilizing this work to make that collective push to shift the needle and start some change in our systems. It's also rooted around what I call the room where the magic happens, and that's that space where we do the enhanced oversight and collaborative problem solving. So we have pre and post removal conferences that bring down the adversarial nature of children transitioning into care and informing people early on about what they can expect and how they can play a part in this process. But we also have monthly family team meetings where we're getting together to truly problem solve that are parent-led and family-driven, and meeting the needs of the child and focusing this work around the lens of the child and how we're engaging. We also look at expedited and appropriate and effective services. And here's where we partner with communities to look at the quality of services that are being offered, to increase the community's capacity to do this great work, to listen, and really focus in on where those needs are as a system in order to engage families, and then meeting our communities where they are to try to drive some change and strengthen their work. And the way we do this is really looking at it through a trauma lens. And so really looking at trauma responsive supports. So for us, it's recognizing that journey towards recovery, that it is a journey towards recovery and not just an isolated choice. Looking at the ups and downs that even drive intimate partner violence, and shifting our perspective in the way we respond, which also changes the way we prepare when we're engaging families, and infusing that universal trauma lens so we minimize subsequent trauma through this experience. Recognizing that building relationships inclusive of co-parenting are critical in the incorporation of how we're doing this work, and engaging parents with lived experience to come alongside of us in a partnership to support parents while they go through this journey, and preparing for tomorrow from day one. So concurrent planning is absolutely active in the way we do our work. And lastly, because we know we do not have a magic wand, it's continuous quality improvement. And taking a closer look at our practice to figure out how we can drive change. What could we do better? Where did we find strengths? What's replicable? How do we touch one family with results that will impact multiple families across the system? So taking a close look at those targets, following trends, using data exploration to get to those solutions. Next slide, please. Our work sits in this frame where we are looking at this from a completely different perspective. It's important for us to make sure everything that we do is strength-based, that we are collaborating, and we are looking at diversity. We are looking at racial equity and inclusion and social justice as a highlighted part of our process, that we're prioritizing developmentally appropriate services, and that we're building trauma responsive systems. Next slide, please. But a dear friend of mine shared with me recently something that truly resonated. And she said, how do we support the social and emotional development of a young child without supporting adults around them? And we know that the resilience of a child is a critical part of their mental health. And the more resilient they are, the greater their ability to manage everything that comes in their way, from healthy stress to difficult events. And so by using parent partners, our National Advisor Group for Parent Voices, and even building that framework around family team meetings that is rooted in family decision-making, we're able to elevate the parent's voice in this process. Next slide, please. But our work relies really heavily on this CrossSystems collaboration. So we're addressing the needs at the family level, but also at the community level. And this foundation is informing the community's capacity to work with our families. So we're looking for gaps in resources, for programming, areas, for processes that we could actually replicate in this work, but also identifying how it benefits an individual family, and then something that touches the entire community's needs. And so behind the scenes, the systems partners are meeting courts, child welfare, early care education providers, caregivers, advocacy organizations to actually target those barriers, create change that we immediately download to families and support. That's inclusive of a lot of training for all those around the table in multidisciplinary groups, reducing the silos in the way we communicate with each other, and addressing bias as we promote protective factors. Next slide. So in this work with our active community team, that's that group of people I just shared with you that support the family on that level. We all build these collective partnerships with the goal of reducing how we isolated in an isolated way communicate, but also how we scaffold what we're doing for families who are at risk or involved in care. Next slide. That breakdown is actually done in a continuum. So by bringing gatekeepers to the table to address various services and supports, we look at those pain points, we promote the strategic planning and access to services, the continuity of care, and even utilizing continuous quality improvement to address and enhance the quality of services in the way they're delivered. We do this in the area of mental health, in early care and education, and substance use disorders, and making those intentional partnerships to really streamline the way assessments turn into action and plannings for families. Next slide, I'm sorry. And then this leans a little bit into where Tori was going around how we do this and leveraging resources at the state level and the local level. It's a parallel process. So at the state level, we create state advisory groups for enhanced advocacy and legislative pushes and looking at policy and practice at the state level. But we also get informed on what's happening from the active community team so that we drive change in the areas of prevention, substance use disorders, mental and physical health, two-generational approaches, and other initiatives like court improvement projects and child welfare transformation programs so that we create change there. Next slide. Just to share with you, and the last bit here is our outcomes. Our information is affirming and it does continue to grow. We've done multiple evaluations on a repeated basis in our work. And what I want to share with you is as we compare our outcomes to child welfare as a whole, we see a clear improvement in the reduction of multiple placements for children who are involved in our Safe Babies Court team cases. We're also looking at ethnicities and equality and the way we're doing the work. What we realize is that 93% of the children who were involved in this project were placed in their permanency within a year, which is actually double the national standard that you heard at the beginning. Also, the parents in here we know have high levels of adverse childhood experiences, recognizing that 63% of them who are evaluated in our project have 4 or more ACEs, which puts them in the high risk category. Even in that arena, 30% of them reunify with their children. And if you look at greater numbers of those who are placed with relative and kin, they do not lose connections with their families. We also focus on addressing the root cause of safety concerns. So we monitor the children in all of our cases and recognize that compared to the recidivism rates on a national level, we were sitting in our last evaluation at 0.7% of our children returning into care compared to 9.1% on the national average. We also noticed the exit from care looking completely different for children in care if they were involved in adoption or guardianship. And I want to close, if you could skip ahead one more time. Actually, you're going to skip a whole lot there. This is an infographic that really tells the story of our work. So I just did a long walk about who we are. And the image here really shows you the story of hope and our primary audience and who we target in doing this work. But the fact that this is about walking alongside you in your work, in your respective chairs, doing this work in a partnership from the local level to the national level, and driving change in the center and the heart of this work, which is surrounded by the family and all of those who are lifting them up in care, using our core components that I shared with you earlier to drive change with immediate and long-term outcomes that shift child welfare and shift the way we support families who are at risk in every community, so that ultimately we drive down that number of children who are in care. We increase the number of children who have strong early development. We increase ties to early care and education in our work. And we bring some continuity and collective impact in the way we engage families. And so with the last slide, please. I'm going to go ahead and close. I'm happy to take questions when we get to the Q&A section of our time together.
Darneshia, thank you so much. I think everybody can see from the slides that you showed and the things that you said that this is truly a collaborative initiative, and that it works. It works, and the outcome data is there. So thank you so much. We appreciate it. And everybody, we just want to remind you, put your questions in the Q&A or in the chat. And when we're done with our panel, we're going to bring all the panelists up on the screen. We'll be able to have a nice conversation. All right, so moving ahead now, we're going to move on to Aaron Havig and Minette Mason, who will be talking about the Navigator program that they have in Washington State. Aaron and Minette.
Thank you so much. Again, we're very grateful to be here today to share with you this amazing project. Several of the people are in the audience who are the navigators, so we're fortunate to have them here with us as well. The project is called the Child Welfare Early Learning Navigator Project, and it takes place in Washington State. If you could move to the next slide, please. Minette and I wanted to start out this presentation by acknowledging that we are on Native land. I come to you from Ridgefield, Washington, which is on the traditional lands of the Cowlitz tribe, which is celebrating their anniversary of becoming a federally recognized tribe this week. So 22 years they've been a federally recognized tribe. Minette?
Thanks, Erin. Hi, everyone. I'm Minette Mason, and I'm the Child Welfare Early Learning Navigator Project Facilitator, or CWELN Project Facilitator, and I am occupying the traditional lands of the Silicon tribe. So in contrast to what Erin just shared with you about the Cowlitz tribe, the Silicon tribe is not a federally recognized tribe, and actually they were advised by the Indian office in Washington, D.C. not to be placed in reservations where areas with expected concentrations of white citizens. The treaty negotiators for the United States did not place a reservation near the blossoming town of Silicon. So the Treaty of Medicine Creek actually didn't provide them with a separate reservation, which is why you don't see the Silicon tribe here on this map. Instead, they were directed onto reservations established for their neighbors, such as the Puyallup, Nisqually, and Squaxin tribe. And then we can go on to the next slide, please. So this is just a quick synopsis of what we're going to talk about. We're going to go over where the project came from and what we've learned throughout this process, where we are now, and where we're hoping to go. So we thought we might start with a little bit of context. The Department of Children, Youth, and Families is a fairly new agency in the state. It was created in 2017. It's a cabinet level state agency focused on the well-being of children. And what it did was combine the functions of our state's early learning, children's administrations, and juvenile rehabilitation, which previous to DCYF were in separate organizations or separate agencies. So this agency that we're in now, DCYF, was created to be comprehensive, exclusively dedicated to the social, emotional, and physical well-being of children, youth, and families, and an agency that prioritizes early learning prevention and early intervention at critical points along the age continuum. So reaching families who come into contact with the child welfare system is a key to meeting that goal. Yes. And we have a vision that each child and family goes through the child welfare system will be connected with supports that can enable them to thrive.
DCYF had this amazing opportunity to partner with the Harvard Kennedy School, the Government Performance Lab. And as we're trying to operationalize, what does it mean to really do prevention and align these agencies? I feel that the Swollen project that you're going to hear about really does this. It maximizes everything our agency was designed to do. So by working with these Government Performance Lab fellows, we're able to really dive into what are those challenges in getting early learning referrals for child welfare involved families, and found that red box that's on the right hand side lists a few of these things. So inconsistent identification of families being eligible for those early learning services, difficulty in helping families select the most appropriate service. Some of our communities have a wide range of services available, and some only have a very few. So knowing which ones are the most appropriate and the best fit. Some of the mechanics of making the actual referral, we'll get into that in a little bit, were very difficult. Different referral processes and requirements for each agency, and then inadequate follow-up to encourage service enrollment. So with the goals of this project, we were able to identify what are those opportunities and then dive into a structured project plan so that we could try to increase the engagement of early learning and family support for CPS involved families.
So this is to show you kind of where we are with the project. The map you see, the purple shaded areas are where the families are located. Obviously, we don't have navigators statewide, so we'll get into that in a little bit. We are in 10 offices across the state. We currently have 4 navigators. And we began the pilot thinking about where we could learn how these referrals are effective or not effective. So we looked at areas where there were resource poor and resource rich areas. And so we can talk about that a little bit as well. But the navigators that are on board with us have expertise in both the child welfare and early learning systems. And they work alongside the caseworkers and parents to ensure that interested child welfare families successfully start in services. Just last year, the navigators served families across more than 100 zip codes in Washington state. So that's what you see in the purple shaded areas. And in 2019, Washington was awarded the Preschool Development Grant Birth to 5. And this is a grant that has allowed our CWELLN team to look at our data, to look at our practices, look at the structures, and then make these referrals successful. The CWELLN team have continually improved and adapted this work based on what we're learning in the data. So for example, this project has a goal of expanding services to include an intentional focus on Indian child welfare services in response to initial data findings. And so we've recently hired a navigator to focus on families related to tribal.
So I get to talk to you about the results. So one of the most exciting things about this project is that it has worked exceptionally well. So what you see on this chart is that we've had amazing exponential increases in results here. So these are families that were assessed for early learning needs. So what you see here before the pilot starts is lower numbers of families being assessed. These are done by caseworkers who are trying to manage all of this. When you look at the scope of what our child welfare workers are asked to do, it is tremendous. And so they're still meeting the needs of families. And then by bringing in this specialized focus, so the pilot starts this third bar here, and then the numbers start to increase. You see the impact of COVID a little bit, and then the further increase. So what we know so far is that since October of 2019, 67% of families who engaged with the navigators had positive outcomes, leading to a wide range of referrals. And then next slide will go into some of those referrals. If you can click the next one. So of these, so in 2021, this talks about the 4,762 child welfare cases and where these referrals went to. One of the unique pieces with this project is we quickly pivoted and added any member of the household who was under age 5. So it doesn't have to be just the child as a victim is under age 5. Any member of the household who is populates onto the navigators case flow, they contact the families, assess them for what the family needs, and provide those connections. This pie chart shows you where most of those connections happen. So childcare is a big one. In some of our areas, accessing childcare can be really difficult because there's not a lot of slots, not a lot of community capacity. So the relationship that the navigator is able to hold on behalf of the department and the child welfare services, and that relationship with the community to know how to make those referrals successful, makes this connection work. It's like stacking Lego bricks on top of each other. They click together. Other popular services are our ECAP services, which is state funded services for preschool, and Head Start. We see a lot of referrals in those buckets, as well as our early intervention services. We have other specialized services, and that's where you get some of that variation of community resources that are available and what we're able to access. Some of the reasons why families haven't been able to access services was delays in services due to COVID. That was something that was impacted for our navigators as well. So being able to get that, the provider not being able to contact the family, or if the family is placed on a wait list, we don't count them as a successful referral because they're still on that wait list. And we monitor and provide support throughout. Next slide.
So this slide just kind of shows you where we are as far as implementing statewide. So obviously we're just in a pilot stage and we're learning all that we can from our 4 navigators, but we're hoping to take this work statewide. And these are some different ways that through the GPL we looked at doing. So the solid green check marks on the top indicate pieces that we've actually made changes to because of the project. And the not solid green check marks that you see are pieces that we're still working on. So one of the challenges that we encountered in increasing referrals prior to the navigators was that there was no easy way to identify families involved in CPS who were under the age of 5. And so what we did in our case management system is develop a report that feeds from the point of intake children who are ages 5 or younger. So right away, caseworkers can identify when a family may have an early learning need. We've also added some questions that are very specific to early learning in the assessment process. So when a family with a child under the age of 6 or is not in kindergarten yet has a case file created in this case management system, then the system will prompt the caseworker to assess the family's early learning needs and then document whether they're referred to the family, whether they've referred the family to a service. Of course, in these cases, if the child welfare office has a navigator, this is also a time where they would connect probably with the navigator. So in addition to working closely with the child welfare staff to educate families on early learning and family support programs, our navigators also created a conversation guide, which is one of the resources that we can provide later in our presentation. But this conversation guide is really meant to help any caseworker making referrals to early learning and family support programs to have supportive and productive conversation with parents. And then going into the non-solid green check marks. So previously, child welfare staff had to manage different forms, separate information, sharing protocols, changing contact information. They had to manage a lot of different pieces in order to make referrals. And a lot of these referrals were, not really consistent. Sometimes were made through emails, phone calls, and then having to manually record this in the case management system. So what we're hoping to do is use our family system, which is our case management system, use our family system to help workers initiate that process. So we're not quite there yet, but we're hoping to get there. We're also trying to fine-tune how we're tracking referrals. So once a family has been referred to a service or a program, how are we tracking that enrollment was complete and they're successfully participating in those programs? We're not quite there yet either. And I'm not sure this got mentioned earlier, but also you'll notice that in this process, the referrals are happening fairly early in the process of child welfare. So these are families who are at intake, are being screened in for CPS, and so they're not quite as deep into the system yet. So we're hoping to catch these families early and get them into early learning family support programs early. And then lastly, we've learned that our navigators are in unique positions to become knowledgeable or aware of real-time availability in the services in the community. So our navigators are connecting constantly with providers, along with working with caseworkers and the families. And so those relationships, those connections that was actually mentioned in earlier presentations are really, I think, what's making this project so successful, because they're connecting with providers and they're knowing, you know, what services are available, where their openings are, and what needs to happen. We're also finding that we're learning where there are gaps in services in those communities. So that's something for us to look at as well. And then we can go on to the next slide, please. So one of the things that we did was we wanted to see how this was going in the field. And so we recently sent out a survey to our caseworkers. And so what you see on this slide are some of the responses. The question that we asked is, what has been most helpful, rewarding, and or exciting for you while working with the navigator? And I'll just kind of read these aloud. So one CPS investigator said, my focus was on the investigation and assessing for child abuse and neglect. The navigator was able to be a positive connection for the family, no matter the outcome of the investigation. Another caseworker said, I learned more from my navigator and we were able to review best options. The amount of knowledge is very beneficial, and especially when it is hard to remember all the special areas. Another caseworker says, there are a lot of Black, Indigenous, and people of color in our community, so being able to connect families with resources that are relevant to their cultural practices is always beneficial. And then lastly, the navigators are able to identify specific educational needs for the family and make those contacts for the primary worker. They help ease the caseworker's workload, and they are able to answer any questions the family may have and follow up on any services. Okay, so here is where we are and where we're hoping to go, I guess, if you want to call it that. That's kind of a map of the state right there and the different regions of our child welfare field offices. So you'll notice in the green, those are our wonderful navigators who are probably in the audience as well. And then we also have a team of supervisors. Erin is one of them. And then we also have a data and evaluation team who some of those folks might also be in the audience. So our small but mighty team are what's making this project so successful. And we're hoping that by sharing this information and by sharing the impact that our navigators are having, that we'll be able to implement statewide. So you'll notice those other 3 regions where we have not yet identified a navigator position. We're hoping to get that there. And yes, we are also filling a few vacancies. So we're going to grow a little bit here pretty soon. But this is kind of where we are.
The other thing that
so
I would
in the meantime,
sorry, Minette. The other thing I would add to this is that the positions are located within different parts of our organizational structure, and that gives us tremendous flexibility and ability to solve problems really fast. So if we're running into an issue that's a contracted service, we can get the answers because the supervisors aren't paid for out of the grant. They're paid for by their own project divisions. And so like I come from family support, I'm able to make those connections with our family support. Other supervisors are in child welfare or Office of Tribal Relations. So we're able to access everything our agency has to offer in really unique ways.
And also word has gotten out about this project. And so even though there are these regions where there is a navigator position that's not yet been identified, we are getting lots of communication from providers actually in the community who are wanting to get involved in this project and wondering when are they going to get a navigator in their office and that sort of thing. Because we're learning too that community providers are also wanting to support this work and work with the families who are involved with child welfare. And then next slide. Yeah, and that's it. We do have a few resources. I don't know if they've been uploaded in the chat yet or not. But we also have our website, and then if you wanted to take a look at that conversation guide and the accompanying matrix, we have that for you as well. And then the Harvard, the GPL also wrote an article that's published as well that could give you a little bit more insight into what they learned throughout this project.
Okay, all right. Erin and Minette, thank you so much. It is so good to hear about these collaborations that are absolutely working and producing really great results for our youngest children. Whether we're looking at our national implementation of safe baby court teams or your pilot in one state that started small and has produced such great results that you're able to expand across the state. So we appreciate hearing about it. And you know, one of the reasons that we set this particular webinar up in this way was because of the first webinar when we, were kicking off, and we were really giving people a good understanding of what the problem was, right? And we wanted to follow that up right away with evidence that there are things that work, and to give hope, and to give concrete examples and specifics on what we can be doing to make up the lives of our youngest children and their families better. I think that it was Darneshia that mentioned that if we focus on just that 30% of children who are under 3 who have come into care, we could substantially change that entire picture. So that was really powerful, Darneshia. So I just want to, so we've got a lot of questions that are both in the chat and in the Q&A. I know some of our presenters have been trying to answer in the Q&A at the same time. And so just want to, we appreciate you. We appreciate you for doing that. Just want to give an opportunity though, just to ask the presenters, what did you hear from your other presenters that resonated with you, that made you think maybe about something you might want to incorporate in your work, or something that you related to that you heard from another presenter that you want to share with everybody before we go on to the questions from our audience?
I'm happy to dive in. I have to say, I think been fascinated with the Navigator program since the moment I heard it existed. But what really resonated with me is something that I've watched and heard around a lot of tables as we try to engage families in recognizing the cultural humility that needs to be a part of that experience, because it is literally a part of what you're trying to do in the intervention, and the intentional piece of that work with the Navigator program just, it rings so loud to me. It feels like it fills a gap. And it was actually really warming to my spirit as I think about how we're trying to connect families and actually reaching that piece that is a missing part of the story. Even when we feel like we have the right service and we feel like we have the right support, that part of the story is never quite captured so well as the way that you all design and put that together. And so I just wanted to share some appreciation for that.
Yeah, I was going to say the same thing, Darneshia. In doing the research on sort of best practices and policies that states are doing, and we came across the Navigator program pretty late, but it really gets at the heart of what a lot of the issues are, which is how do you help sort of families access these services that may exist, and sort of walk through some of the bureaucracy of it, because that's such a challenge, I think, for families entering the child welfare system. And so there's, there are Navigator programs in other fields like healthcare, and it seems only sort of fitting that it would be something that we could really use in the child welfare system to help families sort of access these services they need.
As I listened to the two of you share at the beginning, one of the things that stood out to me was, Tori, you had said that when services were offered, most families participated. And I think that sometimes it's easy to get into a rut, like a mental rut for me, around like, how do we make the service connect? But the willingness of families is the heart of this. And I think we see that with the Navigator program as well. So I was finding those connections. And Darneshia, I really want more time with that beautiful visual you shared at the very end with the rainbow, because I think that's what our preschool development grant has let us do. Everything about this project is about relationships and building trust and having hope for the future. And our preschool development grant gives us that opportunity to try these things out and build those relationships that are so fundamental and give us access to so many different resources. So it was really a beautiful illustration to be able to see.
And I was just gonna mention one more thing, if it's okay, Cynthia. The navigator is that actually strikes me that there is some parallel, Darneshia, to the work that the court teams do with the community coordinator, and so much of what the community coordinator does, and Darneshia, you can speak to this, you know, they're not a caseworker, they're there to sort of link these, you know, the different partners and services, and that's really their role. And so it just strikes me that there's, you know, there is sort of synergy there too with what we do. I don't know if you wanted to speak to that.
I could add to that, Tori. Honestly, the piece that really connects across those two is the relationship. This can be isolating work, but it can also make folks who are trying to sit in the seat of help feel like they own that part of the work. And there's something to be said about having someone come in who says, my sole functionality is to support you all across this work in the system, which allows us to do more than we were originally able to do on our own. But also sometimes that streamlined piece of communication or the scaffolded way that we do services and supports allows that work to even be easier in the most difficult circumstances, and it produces that shared accountability where everyone is feeling like they're part of something that's greater than their own isolated system. I think that really rang a lot. We shared a lot of information about the Navigator program with coordinators, and all I can imagine is, like, I know we're in Washington State, and our team in Washington State was going, where are we, where this program is, because we have got to connect some immediate dots. It's such a shared relationship. It's beautiful.
It is beautiful. I'd like to pick up now on this theme of relationship building, because it's always about relationships, right? And so whether we're talking relationships between systems that are basically navigated through the individual people that are doing the work, or the relationships there on the ground, it's still always about the relationship. So I just wanted to ask this. We've got a couple of questions that relate to the Safe Baby Court teams, and in particular, Darneshia, how do you go about engaging the court personnel, the judges and the attorneys and the, you know, all of the folks? You know, we always say with the children in foster care, don't just come with parents. They come with two sets of lawyers and a judge and a caseworker and somebody else and somebody else. And so part of the, you know, the challenge for people who are trying to engage with these children and families is that they have so much more to engage, right? And so, so how do you get the legal part of the system engaged with this program?
For us, it really is impossible to do this without the legal part of the system. You've got to have a judge that is interested and invested in moving this work forward as much as you have a child welfare agency that wants to invest and move this work forward and do, if you will, some rewiring in the way we engage and what we do in standard practice. Right now, it's a little bit more difficult because we know we're dealing with backlog in the courts. We're dealing with a lot of compassion fatigue from attorneys across the country, as there's a high level of turnover across every entity, child welfare, other service providers, and usually that person who's still at the table is the attorney. So they're carrying the weight of current times, which makes it a little bit harder to see what is possible. But sometimes the shift in practice is literally the low-hanging fruit that we have the ability to touch and reach out to. So some of it is education around pieces that they may not understand and the why that would drive decision making, which shifts advocacy, but it also shifts expectations from the court. We created a micro-learning series with CapLearn in the Children's Bureau, which I'm happy to drop in the chat, and it's everything for judges and attorneys about the science of early childhood and how that's applicable in the courts, which promotes a little bit of that learning there. We also run consistently every month communities of practice for judges, attorneys, clinicians, and even building some concentrated work groups and focus groups for child welfare, just so that we could touch these issues and bring in the learning interwoven in the way we are practicing. It's not a one and done. Often it's bleeding on every single piece of the work. So looking at the integrated relationship between early care and education and what's happening in child welfare is not isolated pieces, but pieces that should be integrated across systems and promoting advocacy for mental health supports within the classroom. We know what ACEs look like when they pour out in the class, but also recognizing what child welfare workers need to share with early care and education providers about what that child is experiencing and how they connect to them and create safe places. So communication is key. So a lot of it is training and support around framing communication opportunities and using tools and vehicles to actually promote that as a part of ongoing practice. And then we bring it all together really in our family team meeting so that we have the conversations, and then we translate that to the court, to the judge, so that they're a part of this bigger experience. And then working on all those barriers and the active community team where they're all a part of that story. So they feel themselves mobilizing, changing their community and not just isolated advocacy for cases.
Yes, wonderful. That it's a lot of work, and you have to. It's a lot, right? And so we've got the whole, cadre of court-related personnel. Let's shift and look. We've got also a whole collection of different kinds of providers of early care and education, providers of parent and child types of therapies that Tori mentioned, and we could see the low participation rates. So we've got a couple of questions here about how do you get the providers to take the necessary training to be able to be even available to participate in either program, in the Navigator program and the Safe Baby Court teams. So talk a little bit, whoever would like to start, talk a little bit about the business of training providers so that they can become trusted resources.
A big part of this for us is really using the rooms that people are already in. So if we know staff have professional development, is partnering to do professional development in the setting they were already in to integrate this part in the work. Some of it is doing community-based trainings and making the topic broad enough where it's touching everyone around the table. And so they're going to pull something from that space. If they're inside a site where there's the presence of an infant-toddler court, it's doing strategic planning with that team that says, we can't do this without you. We have a story, but we don't have the whole story without your lens of how this works. So we're speaking directly to their needs inside and outside of an infant-toddler court so that it touches the masses and not just the population of children who are actually directly involved in our cases. It's going where they are. That's the biggest piece of this, and not making an additional ask for them to come into small bubbles to do work with us.
Mm-hmm. That's a great point. And Erin, I'm watching you nod your head, so I think you have something else you want to add here. And I want to throw in an additional question. You know, when your navigators are out there, what are the challenges that they're finding in, really engaging the providers that they're approaching? And what do they do when there just isn't anything? Like you're looking for childcare and it's just not there, or you're looking for a particular type of therapy and it's just not there. The issue of the availability of what the children and family needs is something that you guys have to be dealing with all the time, right?
I'm gonna pivot to Minette and let her answer that because she came off mute first before me. So go ahead, Minette.
Thanks, Erin. Yeah, that is a huge challenge, Cynthia. And I'll also say that with COVID, we learned that became even a bigger challenge with a lot of just turnover in the field happening. And I mean, just the focus on health and safety at that time. So what I would say to providers is really to get connected with the child welfare office that's in your community. If you don't already know who those folks are, get connected and stay connected. Oftentimes there's turnover in the child welfare office as well. And so constant communication of just, hey, this is who we are, this is what our program offers. Because what we've learned is a lot of caseworkers don't know the depth of what these programs can offer to families, the wraparound services, all those pieces that could really support the family, especially in the time when they're going through investigations. What's unique about our navigators is while they are in child welfare offices and while they work alongside the caseworkers, they can work with the family beyond the case. So if a case closes, for example, they can continue to work with that family. So if there was no opening at the time that they initially connected with that family, they can stay connected with them. And when an opening happens, they can connect with them that way as well. So that's what's kind of flexible about the project. But yes, it is a challenge. And that's one of the pieces that we're learning from our project is identifying where those gaps are and maybe trying to target so that we can have more services that are culturally relevant for those families, or just available to get away from those deaths.
Yeah, that's what I was going to add, Minette, is that families get choice, especially at this stage of the referral process. And we want families to have things that they want to do that'll meet their needs. So finding things that are especially culturally relevant services that meet families' needs for when childcare can be open even, and always honoring that the family has option and voice and choice in that as well.
Absolutely. Thank you for that. And then let's have one more question. Tori, there are a couple people who want to know if the policy recommendations that you gave are going to be coming out formally from 0 to 3, and is there going to be TA or support, or what's going to be the follow-up for that?
Sure. The report's coming out in April, and so yes, it will lay out the policy recommendations and much more than what I was able to touch on in a couple minutes there. And the policy recommendations really build on not just our work of an infant-toddler court team, but also all the work of 0 to 3 in these areas of early childhood and basic needs and health. And so yes, they will be available within the report. I put my email in the chat, and so if anyone just wants to email me, I can make sure you get the report, and it's on the list. TA around the support, certainly 0 to 3 provides TA in a lot of these different areas, and then obviously our court team does as well. So you know, we're always eager to hear from and work with states or communities that want support in helping to promote these policies for sure.
That's great. I know that a lot of people in our audience are happy to hear that, and you'll probably be hearing from some of them, I'm sure.
Like, I can vouch for that. Tori is willing to answer any and all of my questions as they've come up.
Okay, well, that's good. So you got an endorsement already, Tori. How about that? So in our last few minutes here, let me just ask each of our presenters if you would just share a final thought for about a minute. Anything that's on top of mind that you want to leave the audience with today?
Don't mind starting. I think for me, what's on top of mind is really considering the story that we tell ourselves about our families. One of the things that I learned when coming into this work is the stigma that comes around families involved in child welfare, or even caseworkers if you're part of the child welfare system. So just being mindful of the story that you're telling yourselves, and where is that story coming from, and what is the real truth. I think that's what's coming to mind. Beautiful. That's wonderful. Somebody else?
I think if I had a final thought in here, I would say this work can be overwhelming and insurmountable, especially when we're living in the midst of a pandemic, but even before, because the pandemic just exacerbated things that we knew. Mm-hmm. There is no single one of us that has the solution for any of this, but every last one of us has 15% of this story. We all have a part to play, and there's something we could all do. The question is who are you talking to, and what do you think your 15% might be? And so it may be independent, it may be as an agency, it may be as an organization, but saying, if there's a child, if there's a family in my path, what is my 15%? Who and how can I partner to create change? And collectively, we really can do this.
Yes, we can. Thank you, Darneshia. Erin?
The other piece I would just add into that is thinking about those opportunities for when families are ready, and how do we insert those services into our families, communities, and our system, so that when a family is ready and looking for service, that service is there and available and can be as responsive as possible. And I feel like the Safe Babies Court is a really good example of it. That's one of the things that we think is why the Swollen project is so effective is you're capturing that momentum at a moment where a family is like, oh, there is a concern, and yeah, I want to do something about it, and you have the right people to help make those connections. So any opportunities that where we can capture and build on that give us a tremendous advantage.
That's what we really mean by family-centered, right? Awesome. Tori, you get the last word.
Or just in doing all this research over the past 2 years around state and local policies and what's been effective, it just strikes me that we sometimes think of child welfare as this other separate system and other separate families that are coming into contact with it, but it's really the families that everyone, many of these systems are already working with, and so it's just figuring out how to develop these partnerships that work, like the Navigator program and like the Safe Babies Court team, and how to get these systems to work together, because so much of what is really child welfare prevention and preventing families from needing to come into child welfare are providing the things that any family needs, really, which is to support sort of good health, meet really sort of those basic needs and early learning opportunities. So it's really what any family needs.
Absolutely. All right, well, we are at time. On behalf of the Build Initiative, I want to personally thank all of our presenters, and I want to thank all of the people who are in our audience today. Thank you for your activity in the chat and the Q&A, and just thank you for being here. And goodbye.